Good morning. I want to take this opportunity to talk with you a few minutes about this crisis that we're all facing and what you can do for yourself and for your family to try to maintain your mental health and equilibrium during this time. This is very, very difficult, I think, for everyone. And if we don't take care of ourselves emotionally and mentally, then things are going to get beyond our ability, I believe, to ultimately control them for ourselves and for our families. And so I want you to consider this with me for a few minutes and let's have a discussion about this because it will affect your safety on the job. It will affect how you approach your job and it will affect a lot of other areas of your life. So, for one thing, when we come to this discussion, we want to start with trying to maintain a practical and a calm approach. Widespread panic can complicate efforts to manage this outbreak effectively. Do your best to stay calm and follow the official advice that's being given, particularly around the good hygiene habits and that sort of thing that are being set forth. The other thing that we don't really want to do is we want to try not to make assumptions to contribute to a sense of community well-being. Remember that this COVID-19 can affect anyone, and regardless of their nationality, their ethnicity, and remember that those people who do contract the disease have not done anything wrong. Also, as far as managing your own mental health, now, because of you gentlemen being out in the essential workforce, you don't have the problems of self-isolation or quarantine. Some of us who are in the at-risk population, which I happen to be because of my age and because of my lung issues, have been put in the position of having to stay at home and to isolate and to quarantine. Now there's people around you who are having to do this, and so not just as a matter of helping yourself, but as a matter of helping them, some things you want to bear in mind, that there are a number of ways to support your own mental health, and even more than that, perhaps your wife, your girlfriend, or someone else that's close to you. Remind yourself and them that this is a temporary period of isolation to slow the spread of the virus. Remember that your effort is helping others in the community to avoid contracting the virus. Stay connected with your family and your friends and colleagues by email or social media or video conferencing or telephone. So don't let some of these people that are inclined to slip away do that, so that they don't get so isolated they have no human contact. And that's good for you and good for them. Also engage in healthy activities that you can enjoy and find relaxing. Keep regular sleep routines and keep eating food that's good for you. Try to, of course, obviously you don't have to worry about maintaining physical activity, but there are people perhaps that you know who are not getting that much physical activity and their routines have changed, and you may want to encourage them along that line. Establish routines as best as possible and try to view this period as something that you're going to learn from. We're all going to learn from this experience. There's no one of us who's going to come out with less knowledge. We're going to know a lot more things, I think. For people that are working from home, it won't be you, but it would be maybe your wife or your family. Try to maintain a healthy balance or help them maintain a healthy balance by having them allocate special particular work hours, taking regular breaks, establishing a dedicated workspace. And if you find the news and the social media distressing, avoid it. Just stay away from it. One other thing that I do want to mention, because I know a lot of you guys have children, when it comes to families and caregivers of children and young people, we should discuss the news of the virus with them in an open and in an honest way. try to relate the facts without causing too much alarm and in a way that's appropriate for their age and also for their temperament. It's important to listen to any questions they may have to let them know that they are safe and that it's normal to feel concerned. If the media or the news is getting to be too much for them, encourage them to limit their exposure. So these are just some things I want to pass your direction this morning. I know that this is a hard time for everyone. I would love to be out on the sites, but cannot be. So I trust that you'll continue to do well, and I want you to know I do miss you all, and I'm looking forward to the day when I can get back out there. Keep these things in mind. This is going to be a hard time for everybody. Let's pull together, and I'll talk to you again, all being well.